everyone. Welcome to another episode of The Spine. We're really excited today to have Dr. Andrew Hecht on with us, who's a very esteemed professor of neurosurgery and orthopedic surgery, and actually the chief of the Mount Sinai Health Spine System. He's also the official spine consultant for both the New York Jets and the New York Islanders. So we're really excited to have him on and talk to you today. So thank you.
Thanks for having me, guys.
Yeah, and I think we're going to dive into sort of a variety of topics today in the few minutes that we have because of his sort of your breadth of experience, and we value that sort of experience that you have. We've been talking before this conversation in the past about, who is all involved in the care for these athletes during the game. And I think that when we watch these games in live or when we watch these games on TV, we only see a couple people that are truly involved, and we don't have a concept of the team, especially in these emergency situations. I think Damar Hamlin really woke everyone up earlier this year when we saw that sort of emergency response. But you've been in this field for a while, and I think that let's start with that. These emergency teams and these assessments. Tell us something about that.
So I think I'll talk briefly about the importance of having what you guys just talked about, is identifying the key players when you're taking care of athletes on game day, and having an important thing to have is something called an emergency action plan. That's not only you have for your team, but that when your visiting team is coming, they have a copy of your emergency action plan. So everybody's on the same page. So as you pointed out so appropriately, is understanding who are the key players involved in taking care of athletes, particularly at the professional level. On game day, you have a whole team of people. You have orthopedic surgeons, sports medicine, you have sports medicine, internal medicine. You have a key team of athletic trainers on both sides, for both sides. You have unaffiliated neurologic consultants now, especially in the NFL, which are often either neurosurgeons, neurologists, emergency room doctors. You have an airway management specialist there. You have paramedics on standby. So there's a whole cadre of people who are involved. And then you have the back end of it, where there's going to be a receiving hospital and a group of people, God forbid something should ever happen. So having, again, first and foremost, is identifying who are the real members of this team for the whole. And usually what happens is that the home team sort of is instrumental in managing this, right? But you have to have the involvement and cooperation of everyone together to make this really a smooth process for caring for the athletes. So the key thing for everybody is having, whether you're taking care of professional athletes, whether you're in a college environment or even in a high school environment, is understanding and generating what's called an emergency action plan, so that you can identify, God forbid something should happen, whether it's a cardiac problem or a spine injury or you broke a tibia, or whatever it is, that you have a plan in place to deal with them before the game starts. So it's not a mystery of what you're going to be doing next.
Yeah, I think that's incredibly important, and for those of us in medicine, I think there's a lot of medical professionals that listen to this, and the idea of practicing for an emergency is something that we commonly do in other hospital settings. But anyone who's ever been involved in some sort of emergency knows how crazy and unorganized it can be if you haven't prepared for it ahead of time. And so
very important.
It makes total sense.
So I tell you, since 2006, 2007, I go down to Jets Complex, for example, in New Jersey, and we go through this with simulations where all the athletic training staff, the team physicians, both orthopedic, internal medicine, spine surgery, we're all there together, and we're all running through these scenarios. And they've gotten more and more sophisticated as technology has gotten more sophisticated, where we actually use an incredible group called Sports Medicine Concepts, who comes in. They bring simulated dummies who have heartbeats and all sorts of scenarios, face down athletes, cardiac issues, spine issues, and all these things, to refresh ourselves with what do we do? How do we turn an athlete? How do you get a face mask off? What are the helmets that the guys are using these days? They change every once in a while. What are the tools that you need to have? And who is going to do what? God forbid something should happen. Who's going to be at the head? Who's going to turn? What's the technique that we're going to use? And all these things make it so much better on game day because it becomes second nature. God forbid something should happen. Now, if you saw Damar Hamlin, and that was a tour de force of care. I mean, they really were on. They were amazing, and that's the kind of thing that I think every team in the league is doing now. Really has their plan in place, and not only is their plan in place, but they have their dress rehearsal every summer, where they're going through 5, 6, 8 different scenarios that could really happen on game day that could affect the outcome of someone's life. So it's become a real team effort in that regard, and that sort of travels down to the NCAA where they do similar things. Good. And a little less formal in high school, often because the energy of play is a little bit less, but still it's something that I think every head coach and every sports medicine physician who's covering a high school game, even if you're a resident doctor and you're covering the high school team,
we've been there.
These guys don't look too big and scary. Stuff happens, right? And you want to have everybody on the same page. So whether you're at the high school level all the way up to the NFL, you want to have this understanding of who's doing what and when. So that's your
description of the preparedness is really important, and I think it's comforting for us fans, and especially parents as well, when they send their kids to these sports and over the years, that there's a group of people who are ready for anything that happens. And we come from the spine perspective, and looking at this from the spine lens. What are the most common spine injuries that you've seen over the years that have required sort of all of this action?
So the common spine injuries that you're going to see as a spine consultant for a team, whether it's high school, college, or pro, is you're going to see the stinger. And the stinger is a unilateral upper extremity episode of numbness, tingling. It could last for a few seconds. It could last for minutes. It could last for hours or days sometimes. But usually they're mostly short-lived. And if I went into the Jets locker room and said, who here has had a stinger? Probably half the hands will go up. Right? But it's very important to understand that that's very different than a cord neuropraxia, which is the second category. But the stinger, this is a very important thing, that it's only unilateral, an upper extremity only, not an upper and a lower on one side, not bilateral uppers. It's just a unilateral upper extremity event. And it's very important to distinguish, because if you have a stinger, you could potentially go back into the game the same day, meeting the following criteria: full painless range of motion of your neck, neurologically normal, and no symptoms, right? So you can't have I have a little tingling left, can't go back.
Yeah.
I have a little neck pain, can't go back. I mean, I have a great case someone sent me from Georgia of a football player in a kickoff return, got hit, said he had zing down the arm, went away, had neck pain. And he's a defensive back. He wanted to go back in the game, and they didn't let him go back in the game. You might have thought that this was a stinger, but he still had a lot of neck pain and a little apprehension. He wasn't giving everybody the full range of motion, and he had a facet fracture dislocation.
Oh,
so
wow.
You have to. These are not trivial criteria. Sometimes people are like, the adrenaline's flowing, what have you. That's why that range of motion part is important, because someone who has that, they're not going to move their neck. You know this from all the traumas and things you've seen over in your careers. So distinguishing what is a stinger from a cord neuropraxia and understanding what the criteria are to go back to play. Now, the second injury pattern is the cord neuropraxia, or the cervical cord neuropraxia. And that's when you have neurologic symptoms in both upper extremities, or both upper and lower, or an upper and a lower. And that's, for that day, game over. That needs to be worked up. The reason why it needs to be worked up, because they fall into several different categories, what the causes of a cord neuropraxia are, right? Obviously, a cord neuropraxia is a cord level event, meaning people use all these different synonyms: a spinal cord concussion, a cord stinger. I think it's good to try to get everybody use the word cord neuropraxia. So when I look at athletes who've had a cord neuropraxia, they sort of fall into 3 different categories. One, you had a cord neuropraxia, but you have no stenosis, no narrowing of the spinal canal. You just happen to have one. And that happens from time to time. Category 1, the least concerning category. Category 2, you have a cord neuropraxia and you have stenosis. You have a congenitally narrow canal. Very important. And category 3 is you have a disc herniation or some other lesion that's generating your cord neuropraxia. So in category 1, we have the least concerns, but you still have to be worked up prior to returning to play. And worked up means you're going to have an MRI. If you have a cord neuropraxia, your day is over because you don't know which of those categories you're in. Right?
Right.
So most teams, you have a cord neuropraxia and you communicate this, that the athletic trainers who are critical and the team physicians are all out there trying to suss out, making sure that stinger that guy says is not a bilateral stinger.
Yeah.
Because we know there's no such thing. And I can tell you over the years, talking to athletes, whether it's collegiate athletes who are going to play in the NFL players who are playing, when I hear they use that expression, bilateral stingers, I know there's way more to this story because there's no such thing. So if you have a cord neuropraxia, that's going to need a workup. Now, if you have no congenital stenosis and no disc herniation, and you have full painless range of motion, and you're asymptomatic and no neurologic symptoms, you could probably return for the next game. If
That's good to know. Yeah.
You have congenital stenosis,
Yeah.
you got to figure that's the toughie. How many of these are we going to let you have before we say,
Right.
So that's where we start, really looking critically at this, because if you talk to quadriplegics who got injured in football, none of them ever say, I remember that cord neuropraxia, right? Or I remember that warning shot where we just don't have, but common sense says otherwise, right?
Yeah.
So that's why we sort of say, we usually will give you maybe 2 of them, 1 to 2 to 3 in that area, depending on what it was. But if you have a congenitally narrow canal and you keep having them, your career's over. And you've been many, many great athletes, unfortunately, who've had to retire. Take Michael Irvin, Tommy Maddox. There's a lot of them. You can go through the newspaper.
Yeah.
You can see these guys who had cord neuropraxias, multiple, and retired, even though they didn't have a disc herniation or what have you. But that's a concerning one that no one quite knows what to do with it. If you go back to Torg's original work and his original studies, some of these folks had dozens of cord neuropraxias, but never got paralyzed. But common sense says multiple cord neuropraxias with a congenitally narrow canal is probably not a good thing. So we've just, we sort of say if you have many cord neuropraxias with a congenitally narrow canal, that's it. And that's where you really need to question these athletes, whether you're meeting them at the high school level, college level, the combine, pro level, trying to suss out were those old stingers really cord neuropraxias. Okay. The third category of that is you most commonly you have a disc herniation. You had a cord neuropraxia, and even if that you become asymptomatic, this is key. We're used to operating on people who have radiculopathy, myelopathy, what have you.
Yeah.
If you're playing professional football or contact collision sports, rugby, hockey, what have you, and you have a cord neuropraxia and you get an MRI and you see a disc herniation. Then the athlete goes, hey, I got no symptoms. Good. Can't play. So you have the disc herniation fixed. And we could debate what to do with that disc herniation.
Yeah.
Right? Let's not get into that today.
Yeah. That's for the next conversation. Yeah.
You can save that for the next person. And but most of us would most likely lean in the favor of a ACDF for that person before they go back to play, particularly people who are going back to collision and contact sports, right? If you're going back to volleyball, I mean, you could argue something else, okay? But I think most of us would lean that way. And then obviously the third category is, you have a devastating injury on game day, right? You have some type of neurologic event that you're boarded and transported to the hospital. And those people, they're obviously not coming back that day, and you have to sort of figure out what it is. But, when the dreaded scenarios when you have somebody who's unconscious and you don't know what's going on, right? And you have to make the assumption that this is a spinal cord injury or a brain injury or something until proven otherwise. And more often than not, these folks are boarded, unconscious, brought into an ambulance, and they wake up. on the way.
Yeah.
And we often get a good sense of what's going on, and that's where I know you've talked to folks who will educate people about concussions and what have you, but they all go through the workup from the brain through the cervical spine to make sure everything's safe. Because remember, these are, again, young men and women, early part of their life, and we want to keep them safe from future harm. So those are the most common injury patterns that we see on game day that we have to sort of suss out whether they're in our head, but afterwards we got to figure out what are we going to do, and most importantly, who's safe to return to play, and who needs maybe to have more of a heartfelt conversation, or does someone need to have something done before they can return to play? And that's why
these are really
with the team, because it is so important. And I can't tell you how important this skill set is. If you're going to take care of athletes, you need to be an excellent communicator, because not just with the team and the athletic trainers and the physicians, but you need to be able to talk to these athletes, the families. A lot of times there's an agent involved, and you got to get everybody on the same page, and you're the most knowledgeable person in the room. So and you're going to have the same conversation over and over again with everybody that's important to this athlete, because that athlete is your absolute focus.
Absolutely.
And more important than any position or how great a player he is, it's this person is your absolute priority. And remember, never lose sight that they have a long life ahead of them. So it's easy to get swept up into these things, and you have to be the voice of reason and rational thought as you're taking care of these guys.
Yeah, I think your point that there are many different stakeholders that are involved in especially professional athletes. I think the decisions become a little easier at the high school level, and maybe even at the collegiate level, but especially the professional level. There's just a lot of people that have different interests going on, and like you said, the most important thing is the player at the center of it, because they have a long career ahead of them. And you got to take care of that young man or young woman.
That's right. Even at something like the NFL Combine, they're evaluating folks from a medical standpoint. Really, a big part of it is just making sure that this athlete is safe to play.
Yeah.
Obviously they're trying to gauge their risks and stuff, but more importantly, they want to make sure that these young men who are going to go out there are safe to play. And that's another important part of this.
Yeah. Well, Dr. Hecht, thank you so much for joining us today. I think this was such a fun discussion, and again, your experience across sort of this field as a whole spectrum, and your involvement in the pro sports arena. I think it's nice to hear sort of the team effort that's in place, and that we can feel safe watching the games, sending our kids to to play, and even playing ourselves from time to time. But thank you again so much for your time. This has been a lot of fun.
Thanks for having me.
Next time. Yeah. Until next time, don't forget to follow us and subscribe on YouTube. Take care, everyone.
Keep up the great work. See you guys.
Thanks, Dr. Hecht.